Arthritis is one of the most common chronic diseases among middle-aged and older adults worldwide, affecting more than 30% of the population. Even more shocking, as you get older, the rate of arthritis keeps climbing year after year, especially in people over 50, where almost everyone will experience joint discomfort at some point. Those so-called normal joint pains can actually be early warning signs of arthritis, a condition that can rob you of your mobility and seriously affect your quality of life. The good news is, with simple exercises, you can ease joint pain and even help prevent arthritis. Today I am going to show you 5 simple moves that help you protect your joints, reduce discomfort, and get your mobility back. Joint pain, especially in the knees, shoulders, and wrists, often affects daily life. Maybe you have felt pain in your knees when you bend down, or discomfort in your wrists when you lift something heavy. Many people choose to ignore these small aches, but they may actually signal the beginning of arthritis. Arthritis does not just slowly take away the flexibility of your joints. It also causes swelling, stiffness, and limited movement, and in severe cases you may even end up needing surgery. Long-term joint pain affects your work, your ability to exercise, and your quality of life, and in some cases can even make you lose your independence. Research shows that arthritis is closely related to age, obesity, long periods of sitting, and lack of exercise. If you do not take action in time, joint wear and inflammation will keep getting worse and may eventually cause permanent joint damage. However, the bad news does not mean there is no hope. The good news is that exercise is one of the most effective ways to prevent arthritis. Doing proper joint exercises regularly can help improve flexibility, strengthen the muscles around your joints, reduce the load on them, and slow down inflammation. Exercise also boosts blood circulation, helps your joints absorb nutrients better, and helps prevent joint degeneration. Next, I will introduce 5 simple but effective exercises. They do not just help you prevent arthritis, they can also help you relieve discomfort when your joints already hurt. And please pay special attention. The last move is the most important one. Before I start explaining these exercises, I would like to know where you are watching from. Which country or city are you in? Tell us in the comments. We promise to reply to every single comment and talk with you about joint health. Now let us get into the first exercise. 1. Chair squats. For older adults with arthritis or joint pain, chair squats are a very effective strength exercise. By strengthening your quadriceps on the front of your thighs, the muscles on the back of your thighs, and your glutes, chair squats can reduce the load on your knees, hips, and other joints. Strong muscles provide extra support, help slow joint wear, reduce pressure on the joints, and in turn ease arthritis pain. Because chair squats involve repeated bending and straightening of the knees, they help improve joint mobility and flexibility. Doing chair squats regularly helps keep your knees and hips moving through a normal range of motion and reduces stiffness and limited movement. This is especially helpful for people with knee osteoarthritis and hip osteoarthritis. Even though arthritis itself causes joint pain and inflammation, the right amount of exercise can reduce these symptoms. Scientific research shows that strength training such as chair squats can effectively reduce inflammatory responses in the joints, ease pain, and improve quality of life. Exercise helps improve joint condition by reducing pro-inflammatory factors in your body. Here is a safe way for middle-aged and older adults to do chair squats. Choose a sturdy chair that will not slide or tip. Sit on the chair with both feet flat on the floor, knees bent at about 90 degrees, and hands resting naturally on your thighs or held in front of your chest. Keep your back straight and your chest slightly forward. Place your feet about shoulder-width apart, with your toes pointing straight ahead or slightly outward. Slowly stand up from the chair, using the strength of your leg muscles to lift your upper body. Make sure your knees do not go past your toes and avoid pushing too hard. After you stand up fully, slowly sit back down, controlling the descent so you do not drop down and overload your knees. Each squat can take about 3 to 5 seconds from sitting to standing and back down. At the beginning, aim for 10 to 12 repetitions, 3 sets per session. If you feel comfortable, you can gradually increase the number of repetitions and sets. As you get stronger, you can slowly increase the difficulty by adding resistance, for example using a barbell, dumbbells, or resistance bands. But before you add extra load, make sure you have mastered the basic movement to avoid injury. If you feel sharp discomfort in your knees or other joints, stop the exercise. You can try lowering the intensity first and let your body adapt gradually. Research published in Arthritis and Rheumatology shows that strength training, such as chair squats, can significantly reduce pain and functional problems in people with knee osteoarthritis. The study pointed out that appropriate strength training improves muscle strength, reduces joint load, eases pain, and increases joint range of motion and stability. According to the Journal of the American Geriatrics Society, strength training brings clear improvement for arthritis symptoms in older adults. The study found that regularly doing chair squats and other strength exercises can improve lower body strength, reduce joint inflammation, and increase daily activity capacity. 2. Straight leg raises. Straight leg raises are a simple and effective exercise, especially suitable for older adults with arthritis or joint pain. They help strengthen the muscles in your lower body, improve joint function, reduce pressure and pain on the joints, and make everyday activities easier. Straight leg raises mainly work the quadriceps on the front of your thighs, which are crucial for older adults. Stronger quadriceps can effectively reduce the load on your knees and reduce discomfort from arthritis during walking, stair climbing, and other daily activities. Strong thigh muscles provide extra support for the knees, reduce joint wear, and slow joint pain. By strengthening the leg muscles, older adults can better control joint movement and reduce pain and injuries caused by unstable joints. For older adults with knee osteoarthritis or hip osteoarthritis, straight leg raises help improve joint function. Straight leg raises are also a functional movement that improves basic abilities like sitting to standing, walking, and going up and down stairs. By strengthening the leg muscles, older adults can maintain higher levels of activity and independence, reducing movement limitations caused by arthritis or joint pain. Here is a version of straight leg raises suitable for middle-aged and older adults. Lie on your back on a yoga mat or bed with both legs extended and your back resting comfortably on the surface. Let your arms rest naturally by your sides and stay relaxed. Keep the natural curve of your spine and do not press your lower back down too hard. Keep one leg straight and resting on the floor. Slowly lift the other leg, keeping it straight, until your thigh is at about a 45-degree angle to the floor. Hold this position for 2 to 5 seconds and feel the tension in the front of your thigh. Slowly lower the leg with control and do not let it drop suddenly. Repeat the movement 10 to 15 times per leg, 2 to 3 sets each time. When you first start, go at a slow and steady pace to make sure the movement is controlled and you are not moving too fast, which could cause discomfort. If you feel comfortable, gradually increase the number of repetitions and sets, for example 2 to 3 sets of 10 to 15 repetitions. Exhale as you lift the leg and inhale as you lower it. Keep your breathing smooth and avoid holding your breath. As you get stronger, you can add a resistance band or light ankle weights during the leg raise to gradually increase the challenge. If the full straight leg version is too difficult at first, you can start with a simpler version, such as lifting the leg while sitting on a chair. After the exercise, you can do some gentle stretching to relax the legs and back, which helps relieve possible muscle tension. According to a study in the journal Arthritis and Rheumatology, regular lower body strength training, especially exercises like straight leg raises, can significantly reduce pain and movement limitations in people with knee osteoarthritis. The study found that by increasing quadriceps strength, you can effectively reduce the load on the joints and reduce inflammation. A study published in the Journal of the American Geriatrics Society pointed out that quadriceps strength is a key factor in preventing knee inflammation and reducing pain. The research showed that strength exercises such as straight leg raises help build quadriceps strength, improve knee function, and reduce pain and discomfort caused by knee osteoarthritis. 3. Knee bends and extensions. Knee bends and extensions are a very effective exercise, especially suitable for older adults with arthritis or joint pain. This exercise strengthens the knee joint and surrounding muscles, improves joint mobility and flexibility, reduces joint pain, and improves quality of life. Knee bends and extensions effectively work the quadriceps, the muscles on the front of your thighs, which are crucial for knee stability and function. By strengthening the quadriceps, you reduce the load on your knees. For people with knee osteoarthritis, strong muscles better support the joint and reduce pain and discomfort caused by degeneration. Regularly doing knee bends and extensions helps improve knee range of motion and prevent stiffness. For people with knee osteoarthritis, joint flexibility and range of motion are often limited. Knee bends and extensions help maintain normal knee motion and reduce pain caused by restricted movement. Exercise also promotes the production of synovial fluid inside the knee joint. This fluid lubricates the joint, reduces friction between the bones, and slows joint wear. Knee bends and extensions increase joint fluid movement, which helps reduce inflammation and pain caused by arthritis. By strengthening the muscles around the knee, knee bends and extensions improve joint stability. Strong muscles provide more support for the joint and reduce pain or accidental injuries caused by instability. A more stable knee also helps reduce the risk of falls. In the early stages of knee osteoarthritis, appropriate exercise can reduce pressure on the joint by strengthening the supporting muscles. Knee bends and extensions are low-impact exercises, making them especially suitable for older adults with knee pain because they effectively reduce inflammation and wear in the joint. Studies show that moderate knee movement can reduce inflammatory responses triggered by arthritis and relieve pain. As the muscles around the joint get stronger, movement limitations caused by inflammation are reduced and quality of life improves. Here are some practical knee bend and extension variations suitable for middle-aged and older adults. Sit on a sturdy chair with both legs naturally resting on the floor and your back straight. Lift one leg and slowly straighten the knee, holding for a few seconds until you feel tension in the front of your thigh. Then slowly bend the knee and place the leg back on the floor, keeping the movement controlled so the knee does not drop suddenly. Do 10 to 15 repetitions per leg, 2 to 3 sets each time. When standing, place your feet shoulder-width apart, keep your back straight, and maintain balance. Lift one leg and bend the knee to a 90-degree angle, holding for a few seconds. Then slowly straighten the knee until the leg is fully extended. Slowly bend the knee again and return to the starting position. Do 10 to 15 repetitions per leg and gradually increase the number of repetitions and sets. When lying on your back on a bed or yoga mat, keep your legs straight and your back relaxed. Lift one leg and slowly bend the knee, bringing the heel as close to your glutes as you comfortably can. Then straighten the knee again while keeping tension in the front of your thigh. Do 10 to 15 repetitions per leg, 2 to 3 sets each time. As you progress, you can use a resistance band or light ankle weights to increase difficulty. Adding resistance during knee bending and extension helps strengthen the muscles around the knee joint. If your knees feel uncomfortable after exercising, take a break and apply ice to help reduce inflammation and pain. Controlled and stable movement is very important, so avoid over-exercising and avoid aggressive stretching. 4. Cat-cow stretch, yoga. Cat-cow stretch is a classic yoga pose that has significant benefits for older adults, especially those with arthritis or joint pain. Through gentle spinal movement and coordinated breathing, cat-cow not only improves spinal flexibility, but also helps reduce joint pain and enhance overall body coordination. One main benefit of cat-cow is that it promotes spinal movement and improves flexibility. For older adults with arthritis, especially spinal arthritis or neck problems, doing cat-cow regularly can effectively relieve spinal stiffness and reduce pain caused by limited spinal movement. Better spinal flexibility can also reduce joint discomfort caused by poor posture or tight muscles. Cat-cow helps improve the flow of joint fluid and can reduce inflammatory responses in the joints. By moving the spine and nearby joints through extension and flexion, it helps reduce stiffness and discomfort, especially in the knees, hips, spine, and shoulders. Coordinated breathing during the exercise also helps relax muscles and ease pain caused by excessive tension. For blood circulation, especially around the spine and joints, bending and extending the spine stimulates blood flow around the vertebrae, increases oxygen supply, and improves nutrient delivery, which supports joint repair and health. Cat-cow emphasizes syncing movement with breathing, which improves coordination between muscles and joints. For older adults with arthritis or joint pain, this is especially important because good coordination improves movement quality and reduces injuries and pain caused by poor control. During the exercise, deep breathing helps regulate overall body tension and release stress. Many studies show that long-term stress and anxiety can worsen arthritis symptoms, especially rheumatoid arthritis. By helping the body relax, cat-cow not only releases muscle tension, but also improves mood and reduces pain. In addition, cat-cow helps improve spinal and pelvic posture and maintain the natural curves of the spine, which reduces excessive load on the spine and joints. It helps restore better posture so that older adults can move more easily in daily life. Here is a cat-cow method suitable for middle-aged and older adults. Start on all fours with your hands and knees on the floor. Your shoulders should be aligned over your wrists and your knees under your hips. The tops of your feet rest on the floor. Keep your back flat at first, eyes looking toward the floor, and your spine relaxed. As you inhale, slowly drop your belly toward the floor. Lift your head to look up at the ceiling. Push your chest forward and lift your hips so your back forms a gentle arch. In this movement, your spine extends and your chest and abdomen open up. As you exhale, slowly arch your back toward the ceiling, pull your belly button inward, and round your spine like a stretching cat. Lower your head and look toward your belly. In this movement, the spine flexes and the muscles in your back and neck get a gentle stretch and relaxation. Alternate between cat and cow, keeping each movement slow and controlled, and match your breathing with your movements. Do 10 to 15 repetitions per set, and you can increase the number of repetitions based on how you feel, doing 2 to 3 sets each time. Inhale in cow, exhale in cat. Keep your breathing natural and smooth, and avoid holding your breath. If you feel any discomfort or pain during the movement, stop immediately and check whether your form is correct. Do not hold any posture for too long and avoid overstretching. According to a study in Arthritis and Rheumatology, yoga, including cat-cow, can significantly improve pain and functional problems in people with arthritis. The study found that yoga effectively reduces inflammation, eases joint pain, and helps improve joint mobility and function. Research published in the journal Sports Medicine has shown that yoga can significantly improve spinal and joint flexibility, especially in older adults with spinal arthritis and knee osteoarthritis. As a common yoga pose, cat-cow helps increase spinal range of motion and reduce pain caused by stiffness. 5. Water walking. Water walking is an excellent exercise for older adults, especially those with arthritis or joint pain. The buoyancy of water helps reduce pressure on the joints while enhancing the effectiveness of the exercise. It is a low-impact but highly efficient form of aerobic exercise. The buoyancy of water supports body weight and reduces the load on joints, especially the knees, hips, and spine. For older adults with arthritis or joint pain, Water walking reduces the impact on joints during exercise and eases pain and discomfort caused by arthritis. Research shows that water exercise can reduce the pressure that body weight puts on joints and relieve pain caused by joint friction. For improving joint flexibility and range of motion, water walking is very effective. Water resistance helps strengthen muscles, while buoyancy allows joints to move in a relatively low-pressure environment. For arthritis patients, water walking helps maintain joint flexibility and reduces functional problems caused by long-term joint pain. Water walking also helps promote blood circulation and reduce swelling and inflammation. The pressure of water helps boost blood circulation and improve lymph flow, which helps reduce joint swelling and inflammation. By walking in water, older adults can more easily remove waste products from the body, which helps reduce swelling and pain caused by arthritis. In addition, water resistance makes the movement more challenging in a good way, which helps train heart and lung function. For older adults, water walking improves overall aerobic capacity and endurance, helping to improve fitness and health status. Stronger heart and lung function helps reduce the risk of chronic diseases such as heart disease and high blood pressure and improves daily activity levels. Water walking is also safer than walking on land. Especially for older adults with knee or hip problems, water walking greatly reduces the risk of falls or sprains. At the same time, because of the resistance of water, exercise intensity can be adjusted according to personal fitness and joint condition, avoiding overtraining. Here is a water walking method suitable for middle-aged and older adults. Before you start, make sure you are exercising in a safe swimming pool. The water depth should reach your waist or chest. Water depth is crucial for reducing joint pressure. Choose a comfortable swimsuit or workout clothes and make sure you feel stable and balanced in the water. Start near the pool wall or in the shallow area. Keep your back straight and swing your arms naturally. Step forward alternately with both feet at an even pace. Try to land with the whole foot or mainly the ball of the foot, avoiding excessive force on the toes or heels, and keep the movement smooth. With each step, try to push a bit harder so that water resistance helps train the leg muscles. To enhance the effect, you can try different walking patterns, such as high knee walking, faster steps, sidestepping, or walking backward. These variations train different muscle groups and increase intensity. Lifting your knees to waist or chest level increases hip and leg flexibility. Walking backward helps work different muscles and improves joint stability. At the beginning, you can start with 5 to 10 minutes per day and gradually increase to 20 to 30 minutes. 3 to 5 times per week. Adjust the intensity and duration according to your physical condition and avoid over-fatigue. While walking in water, keep your back straight, avoid hunching, and maintain correct posture. Keep your breathing steady and avoid holding your breath, especially when you increase exercise intensity. As your body adapts, you can use water walking tools, such as aquatic resistance bands, to increase resistance and further strengthen your muscles. These exercises are not just physical training. They are an important way to improve your quality of life. Through these exercises, you are not only relieving joint pain, but also increasing your independence. Imagine being free from constant joint pain. You will be able to move more freely in daily life, walk more comfortably, and enjoy exercise more. With daily consistency, your body will become stronger, your joints will become healthier, and these changes will bring you more confidence and energy. Exercise does not just change your body, it changes your quality of life. Every small effort is a step toward a healthier, more independent life. You are no longer controlled by joint pain. Instead, you have more possibilities to enjoy life. Now you know 5 exercises that can help you prevent arthritis and reduce discomfort. Do not wait. Start today. If you stick with these moves every day, you will see clear improvement. Joint pain will gradually ease, and your flexibility and mobility will keep improving. If you like this video, please like it and subscribe to our channel. We will continue to share more advice on joint health and exercise for older adults. If you have any questions or exercise experiences, feel free to share them in the comments. We will carefully read and reply to every comment. Also, do not forget to share this video with your family and friends so they can benefit as well. At the same time, keep browsing other videos on our channel to learn more about exercise and health. Every step you take can make you healthier.